Hi, Juliana. SMA has changed a lot in the past few years because of the appearance of these new disease-modifying treatments. We now see differences in terms of the phenotype and the clinical features of these kids. So I'd like to ask you, what is, in your opinion, the main changes that we are seeing in terms of the phenotype of these treated patients?
So, Marcondes, we can see following these patients that are using the new drugs, that the patients change. Sometimes the patient that was classified as type 1 become more similar to a type 2, and the patient with type 2 become more similar to type 3. However, we can see some clinical manifestations that we didn't see in the classical forms. So especially we have kyphosis, also we have some abnormalities in the hip, and also we can see that these patients are not needed a full respiratory support, but they sometimes need to maintain the nocturnal ventilatory support. So they are not similar to the classical forms. It's not just changing the type. They have some specificities in the clinical manifestations that we need to learn. So how to manage this. So it's a new phenotype. And because of this new phenotype, Marcondes, do you think that the classification of these patients that are using new drugs will change in the future?
Yeah, I think so, definitely. I believe that this classical classification in type 1, 2, and 3, based in the age at onset of symptoms, will be no longer, usual. We need to think about new ways of classifying these kids, taking into account the long-term follow-up, and especially taking into account the age when they begin to be treated with these new drugs. And in addition, I think that we also need to think about novel clinical tools to capture the whole phenotype. So, for example, in my patients, especially those with more later onset of the disease, we're beginning to see symptoms like fatigue, which are not captured by the typical clinical scales. And we are going to be more, we need to be more comprehensive when we look at these kids in our clinics, in our hospitals.
Yes, it's very important. The fatigue, I think it's a point very important in these patients, and we don't have a very good tool for pick up these symptoms. I think it's very important to go on with these new tools.